Hello friends, welcome to my channel Healthy World. Today I will speak about hypertension.
Hypertension is an intermittent or sustained elevation of systolic or diastolic blood pressure. Blood pressure is the pressure of circulating blood on the walls of blood vessels. Blood pressure equals to cardiac output into systemic vascular resistance. Cardiac output means the amount of blood pumped from heart in 1 minute. Cardiac output equals to heart rate into stroke volume. Stroke volume means the amount of blood pumped from the heart in one contraction. Systolic blood pressure, it indicates the pressure in the arteries when heart beats. Diastolic blood pressure, it indicates the pressure in arteries when heart relaxes. The primary way that high blood pressure causes harm is by increasing the workload of heart and blood vessels, making them work harder and less efficiently. Over the time, the force and friction damages the tissue inside the arteries. Low-density lipoprotein and cholesterol form plaque inside arteries called atherosclerosis, causing narrowing of arteries, which further increases blood pressure. According to American Heart Association, following staging system was suggested in 2017: normal BP, systolic less than 120 mm of mercury and diastolic less than 80 mm of mercury, elevated BP, systolic 120 to 129 mm of mercury and diastolic less than 80 mm of mercury, stage 1, systolic 130 to 139 Hg or diastolic 80 to 89 mm of mercury, stage 2. Systolic greater than or equal to 140 mm of mercury or diastolic greater than or equal to 90 mm of mercury. If there is a disparity in category between the systolic and diastolic pressures, the higher value determines the stage. Classification of hypertension: primary or essential hypertension, and secondary hypertension. Primary hypertension. Causes is unknown. The pathogenesis is poorly understood, but as a result of multiple genetic and environmental factors. Risk factors for a primary hypertension are: age, advancing is associated with increased BP. Obesity, BMI more than 30. Family history, most common subject who have hypertensive parents. Races, more common in Black. Salt intake, excess salt intake more than 5 grams per day. Alcohol, excess alcohol consumption is associated with hypertension. Physical activity, sedentary lifestyle increases BP. Stress. And smoking. Secondary hypertension, results from an underlying cause, example renal, vascular and endocrine. Signs and symptoms. May not produce any symptoms, but some are: severe headache, fatigue, vision problems, chest pain, difficulty in breathing, irregular heartbeat and blood in urine. Clinical presentation of hypertension. History taking. Duration, last known BP, prior treatment of hypertension. Drugs: history of NSAIDs, estrogens, steroids, cocaine, excessive salts. Family history. Symptoms of secondary causes like muscle weakness, tachycardia and tremor. Symptoms of target organ damage, that is headache, transient blindness, dyspnea, blurred vision. Presence of other risk factors like smoking, diabetes. Dietary history about salts, processed food, alcohol and saturated fats, and psychosocial factors, that is work status. Physical examination. General appearance, distribution of fat, alertness. Neck, thyroid. Heart, rhythm, sound. Lungs, bronchi, Krebs. Abdomen, Broots over aorta, femoral pulse. Extremities, edema. Neurological, visual disturbance and confusion. Lab testing. Electrolytes, serum creatinine, fasting glucose, urinalysis, complete blood count, thyroid stimulating hormone, lipid profile, electrocardiography. Treatment. Treatments is divided into two-part, non-pharmacological therapy, and pharmacological therapy. Non-pharmacological therapy. Weight loss. BMI should be less than 25 kg per meter square, 0.5 to 2 mm of mercury for 1 kg loss. Healthy diet. Diet should be followed, that is dietary approach to stop hypertension, diet rich in fruits, vegetables, whole grains and low-fat dairy products with decreased fat. Reduce salt intake, less than 1,500 mg per day, approx 1 tablespoon. Increased potassium intake, 3,500 to 5,000 per day, banana, orange, spinach, broccoli, potatoes, cucumber, pumpkin, and brinjal should be eaten. Physical activity, approx 150 minutes per week. Reduce alcohol intake, men should not consume more than 2 drinks daily, and women should not consume more than 1 drink daily. Pharmacological therapy. Drugs should be initiated in BP greater than or equal to 140 by 90 mm of mercury, BP greater than or equal to 130 by 80 mm of mercury with cardiovascular disease, diabetes mellitus, chronic kidney disease, and for age greater than or equal to 65 years. Choice of initial drugs, diuretics, ACE inhibitors, angiotensin II receptor blockers, calcium channel blockers, direct vasodilator beta blockers. Complications: left ventricular hypertension, heart failure, ischemic stroke, intracerebral hemorrhage, ischemic heart disease, eclampsia, and many more. Some important points. Hypertensive emergency, a condition in which elevated BP results in target organ damage. Hypertensive urgency, severe hypertension, BP greater than or equal to 180 by 120 mm of mercury, where there is no sign of end organ damage. Treatment: target BP less than 180 by 130 mm of mercury in first hours, then less than 160 by 110 mm of mercury in next 23 hours, rarely less than 130 by 80 mm of mercury in first 24 hours.
Thank you. Please like, share and subscribe and do comment.